And as we wait to get this broadcast up on Facebook for our communities, I just wanted to welcome you all. My name is Sharon Bogan. I'm with Public Health Seattle and King County. Thank you very much for joining us today for an update on COVID-19. As we do often, if you have a question after Dr. Duchin has finished with his remarks, you can use the raise your hand function and I will call on you. And I'd like to limit, if possible, to one question today because we do have a hard stop at 2:30. For those of you that are listening or want to do interpretation, hear the simultaneous interpretation in Spanish, you can click on the icon at the bottom of the screen that looks like a globe, and you can change it between English and Spanish, and we have simultaneous interpretation live for you. And I'll say that in Spanish for our Spanish media as well. Tenemos el intérprete hoy día y se puede seleccionar el botón al parte inferior de la pantalla y selecciona español y allí se puede escuchar el comentario de Dr. Duchin, pero en español. Muchas gracias. Y con esto vamos a regresar a Dr. Duchin. So thank you again for being here with us, and I will turn it over to Dr. Duchin for your remarks.
Thank you, Sharon, and good afternoon, everyone. I'd like to begin by reminding everyone that starting this week, we've entered the period of open enrollment for health insurance in Washington State through our state health exchange called Washington Health Plan Finder. And as many of you may know, health insurance evaporated for many residents this year with employment reductions due to the impacts of COVID-19. And the uninsured rate went up about 5.5%, from about 5.5% before the pandemic to about 13% last spring. However, since that time, more people have enrolled in options such as Apple Health and the State Health Exchange. And the last estimate is 6.2% remain uninsured, which is still higher than pre-pandemic. With the ongoing pandemic, getting and keeping health insurance is more important than ever, and no one should be left without access to health care. We have enrollment teams to help people remotely or in person. The in-person help includes social distancing precautions to prevent the spread of COVID-19. Our navigators are also helping by phone, video chat, and email. And you can find information at kingcounty.gov/coverage. And now I will provide you with some figures on our COVID-19 situation and some reflections, and then we'll have time for questions. As of this morning, we've had 29,465 COVID-19 cases, 2,629 hospitalizations, and 810 deaths in King County since the outbreak was recognized in February. For the past 7 weeks or so, since the 21st of September, COVID-19 cases have been increasing in King County and regionally in Washington State and in many states across the country. We have reached a new peak with approximately 308 new cases reported each day last week. That's fourfold higher than late September, and over 100 cases per day more than the initial outbreak in the spring. Our 14-day incidence rate is 155 per 100,000 as of Tuesday and is expected to increase. This has placed tremendous stress and overload on our case and contact investigators and on our outbreak investigators, as I'm sure you can imagine. Testing is up through the community, and that's very good. People are taking advantage of our new sites in South King County, Renton, Auburn, Tukwila, and Federal Way. And we want to continue to encourage anyone with symptoms to isolate and get tested and stay isolated until you have your test results. However, along with the increase in testing, the countywide positivity rate has also increased from approximately 2% in September to about 3.5% recently. And this reflects increasing transmission and shows us that the number of cases we're seeing is not just a result of increased testing. And as we noted early in the outbreak, the highest positivity rates are in South and Southeast King County. We are seeing increases among all ages, but predominantly among young and working age adults. 70% of our cases are in the 20 to 60 year age range. The last estimate for the effective reproductive number was just above 1, but that's about 2 weeks old now. That's from the 21st of October. And don't take that as a reflection of today's status, but it tells us that the outbreak is growing or was growing at the time that number was calculated, and we anticipate that it will continue to be above 1, indicating an expanding outbreak. Hospitalizations in October were slightly higher than in September, but the number of hospitalizations remains relatively steady in recent weeks. And that's a key point I want to discuss more with you in a few minutes. Hospital bed capacity is adequate, but our hospitals are not infinitely expandable. They do have limited capacity. We saw a small increase in death counts in October compared to September, but they also remain relatively stable, and the median age of our deaths remains around 80 years. And as I noted, we continue to see the previously described health disparities from COVID-19 disproportionately impacting communities of color, particularly in South King County along the I-5 corridor. The suspected exposures to COVID-19 in our community are manifold. We're seeing broadly distributed risk factors, including household transmission, transmission in the workplace, particularly among essential workers, many community-acquired and travel-related cases, and these are linked to social events and activities with families, friends, get-togethers, parties, celebrations, weddings, and other recreational activities. So I will also focus in on that a little bit in my comments in a minute. So cases continue to accelerate in the wrong direction, and it's best to hit the brakes before we crash and not after. Too many of us are doing too much with too little consideration of the consequences of our actions on others. The risk of acquiring COVID-19 today is higher now than it has ever been, and the longer we wait, the more difficult it gets, and the longer it will take to bring the case counts down. Now, what we should all be worried about is the spread of COVID-19 to more people in our community with underlying health conditions and to older adults who are at higher risk for severe illness and death, and the impact that will have on our healthcare system. Across the country, we are seeing surges in serious illnesses that are stressing hospitals, and I'm concerned about the impact we could see on our own healthcare system and our ability to provide necessary and life-saving healthcare to all people who need it. We can choose our path forward, or we can let the virus choose it for us. Ignoring COVID prevention is a recipe for unnecessary suffering. I understand COVID fatigue and stress, and I feel it myself every day. We need to get our kids back in school, and we need to do other things that are necessary and important to us. Too many cases of COVID-19 are related to community activities and travel, socializing, gathering with friends and family, parties, weddings, other celebrations, visiting bars and restaurants, and even faith-based activities. But I believe we can do the things that we need to do when we work together, and we do them safer, smaller, and smarter. Both our personal health and the health of our economy will improve to the extent that we can stop the spread of this virus. Managing COVID-19 requires long-term changes in the way we go about our lives to protect ourselves, our family members, our friends, and our community. And this upcoming holiday season greatly adds to the risk and the importance of taking action now. We know what works to stop the spread of COVID-19, and our actions as individuals and as a community will determine the course of our outbreak. We need to come together during this difficult time and work together to support and protect one another. We don't have to follow the pathway to pain that so many other communities are experiencing. We still have time to change course. Here's what works. First, remember, you can't tell who has COVID-19 by looking at them. COVID-19 spreads from people before they look or feel ill. We need to expect it where we don't expect it. We need to do better in limiting the number of activities outside the home, the number and duration of contacts with others, and avoiding crowded indoor settings. COVID-19 spreads readily indoors, especially in closed spaces without good ventilation and with longer times spent together and when masks are not worn. And mask use is especially important, critical indoors, even when 6 feet of distance can be maintained, and the mask should be well made and fit well. Pay attention to ventilation, opening windows and doors whenever possible. Hand washing and sanitizing remains important, along with regular cleaning of frequently touched surfaces. And I want to remind everyone of the importance of getting a flu shot this season. Vaccination can not only prevent influenza, but help avoid a mistaken COVID-19 diagnosis and can preserve healthcare resources. We have new drive-through vaccine clinics in Newcastle, Kent, and SeaTac next week on the 12th, 13th, and 14th of November. And you can register for the clinic and check for more upcoming flu clinics at our website, www.kingcounty.gov/find a clinic, all one word, FINDA clinic. And with that, I'm very happy to take questions.
Thank you very much, Dr. Duchin. Please, when I call your name, please, I'll unmute you. And then if you can make sure to say your name and also your news organization, we'd appreciate it. So with that, let's start with Will James.
Yeah, hi, Dr. Duchin. This is Will James from KNKX Public Radio. I think you're a graduate of the CDC's Epidemic Intelligence Service, right? And
that's correct.
So you've been trained in public health messaging and how to do messaging that affects people's behavior. I'm curious, does your training say anything about how to penetrate with a public health message when people have been hearing it for so long? At this point, people have been getting the message for weeks that we're in a fall surge, the pandemic is getting worse, and it's more important than ever to double down on precautions. So how do you keep people from being inured to that information or becoming kind of numb to it?
Yeah, that is the challenge at the moment. What do we need to do to help people make the right decisions to protect their health and the health of their loved ones and their community members? I think about this incessantly. I mean, the fundamentals of public health communication are to be prompt with news and information, to be accurate, to be transparent and explain what's known and what's not known, and to provide updates when new information becomes available, to provide culturally sensitive information and information in languages that people understand. We are facing a unique challenge right now. There was a recent study on global health preparedness that ranked the preparedness of every country in the world to manage a large-scale biological emergency or outbreak. And the US was ranked #1 because of the great resources that we have, the communication systems, the public health infrastructure. But we ranked rock bottom on trust in government. And we also ranked very low, 176th, on the quality of our healthcare system because of the poor access we have. We are the only country among our peer countries that does not have universal healthcare, access to universal healthcare for their citizens. So, we're trying to put a message out that is accurate, and we update with new information as we get it about how the virus transmits and how to protect ourselves. But we're very challenged by the fractures in our society right now and the conflicting messaging that is coming out at leadership levels, I think. That's clearly, the trust in government piece and the lack of social and community cohesion, I think, is playing a role here. That said, though, I think there's also the issue of pandemic fatigue. And we've never faced anything like this in our country, a prolonged outbreak that will continue to nibble away at the susceptibles. It's important to remember that less than 5% of our community have been exposed and infected to this virus. There are plenty of people still vulnerable, and this virus would be very happy to rage through like an uncontrolled fire. We need to do things that we have never done before with respect to the way we change, how we go about our lives, distancing from others and mask use, and also the types of activities, the frequency of activities, and importantly, the duration with which we have to maintain these new behaviors. It's not going to be forever. We will get over this outbreak. It will end. It will decrease gradually, but we are in a very vulnerable time right now with very high risk. And for the next several months, at least, we need to make very concerted and strong effort. And I don't think the public in the United States or elsewhere at this time has ever been confronted with this magnitude of challenge. And I think it's taking a while to sink in, what needs to be done. Folks understandably want this to go away. They want this whole mess of COVID-19 to be a bad dream and to wake up and be able to go back to their pre-COVID lives. I certainly want that. But the unfortunate reality is it won't go away. And to the extent that we pretend it will, we will have worse outcomes, more suffering, more hospitalizations, more deaths. So I am challenged, as you are, in trying to understand, what's the magic sauce here to get the public to do what they need to do to protect themselves and to protect their loved ones, their neighbors, and their community. I do have faith that over time, people will understand, but I fear that folks are going to wait until they see something dire to act. Of course, when we initially had our stay home, stay safe imposed by the governor, it was very effective in reducing transmission. We had large-scale outbreaks in long-term care facilities with very high case fatality rates at that point. And people understood that. Our hospitals were feeling the stress. And I fear that people are going to want to see our hospitals on the brink again before they're motivated to take the steps that we all need to take to bring this thing down to a manageable level. That is my greatest fear. And what I'm hoping is that with the repeated messaging and the rising case counts, and we have the benefit of seeing the suffering that is happening in other communities across the country and the overload in the ICUs and the hospitals teetering on the brink of collapse, that we can choose not to go there. We still have time because our hospitals are still in relatively good shape. It's taking time for this virus to percolate through to the vulnerable. And if people will seize the opportunity to make a difference in how they're going about their lives, in the number of interactions, in having fewer social activities and interactions with other, and making them shorter duration and using masks, I believe that we can avoid a very bad outcome.
Thank you. C.E. Beck, you're unmuted.
Great, thank you very much. Yes, so this is Carolyn Bick from the South Seattle Emerald. Right before this press conference, I did check out the most recent update to the case data on the dashboard. And as you said, there appears to be an extremely concerning rise in South King County. I mean, it's upwards of 3,000 cases per 100,000 residents in the SeaTac-Tukwila area. I wanted to ask what factors are specifically driving that rise? And aside from obviously the current encouragement towards behavior modification, how else is public health going to try to combat this, particularly in the current season when coronaviruses as a whole are more virulent? Like, for instance, are you considering coordinating with places like grocery stores to provide better support and resources for essential workers?
Yeah, thank you for the question. It's a critical issue for us and for our community. We know that there has been disproportionate impact of COVID-19, both with respect to the number of people who are impacted, as you just reminded us, the case rates are higher, but also in the hospitalization rates and the death rates. And this is something we're seeing across our country. And this is an unfortunate consequence of long-term disparities in the social determinants of health and structural racism that has led to this vulnerability. We know that many people in these communities are of lower socioeconomic status compared to the county as a whole. They are disproportionately essential workers who don't have the luxury of telecommuting like many other people in the county do. They need to be out and about every day to help us keep our essential services running, whether it be food services, transportation, or other infrastructure, things that we all depend on to do what we need to do, whether we're out and about or not. So these essential workers are in the healthcare sector, as well as manufacturing and all across our community. They're interacting with the public and they're taking a higher risk of acquiring the infection. In addition, we know that the household sizes are larger, so multi-generational households increase the risk of household transmission. So for these reasons and for others that we may not be aware of, and we're working very hard with community to understand some of the factors that might be driving these increasing rates. There's potential role for distrust of government, for distrust of public health, for distrust of the healthcare system and our advice. That's a potential cause, but I don't know if and how much role that might be playing here. It certainly has been documented in other outbreaks. But we are trying to do what we can to provide equity and reduce these disparities. So here are a few examples. We are hiring many contact tracing staff who represent the community, who have the appropriate language skills. We are using community navigators from the community, hiring trusted messengers to give them information and education that they can share with community members, and then do outreach and provide materials. We're up to 33 languages now that we're able to do COVID education in. We're also in the process of distributing over $500,000 to community-based agencies to address racial inequities through this type of engagement in education. And this will be focusing on Black, Indigenous, and people of color in South King County. We're working through 50 community-based organizations that serve these priority populations. For example, risk reduction materials that we've distributed in SeaTac and Tukwila for the East African community recently. We're also in the process of launching very shortly exactly what you mentioned, support for people who have challenges in quarantining and isolating due to economic hardship. We've been all along providing grocery support, and you can look on our dashboard under contact tracing and see the number of cases that have received that type of support. But in addition to providing groceries for families who need them, we are going to be providing income support very shortly to families who need that. So financial support to allow them to stay home and not have to, if they're infected with COVID-19, to stay home and not have to go into the community and risk infecting coworkers if they're an essential worker and can stay home. And if they're not an essential worker, they can certainly stay home. We also want to provide that income support to people who have been exposed to someone with COVID-19 and are not yet ill, so they can complete the quarantine period without undue financial burden. And we understand, the pressure that people are under, and they need, they need income. And so this, we hope, will be successful, and we would love to continue to expand that program of income supports to as many people as needed. And we'll be very interested to see how the uptake is and how it goes as we roll it out in the next week or so. And then we're continuing to work with task forces that have been set up in collaboration with the community on pandemic COVID-19 and racism community advisory groups. And we hear from community each week and work with them closely and hear their concerns and try and address, the gaps in the issues that they're identifying for us, or when we can't address them, try and engage the other stakeholders who can help us. So with those, it's very difficult. I mean, this is one of my great frustrations, is that in every outbreak or health emergency, like natural disaster, we always, all of a sudden, so to speak, realize that the disproportionate burden falls upon people who are already experiencing health disparities. And yet each time we are faced with the same issue again. And I just hope that this experience leads us to act with more sustainable solutions to address the structural issues that place these communities at risk in the first place.
Thank you. Nick Popham, you can go ahead.
Awesome. Thanks so much, Dr. Duchin. Always appreciate it. It's Nick Popham from Como TV. My question is, I guess you've mentioned it briefly, but I'm curious is where do we go from here with this information? And do we anticipate that, because I've talked with some health experts or doctors who have said that potentially more shutdowns loom, and not so much the shutdowns we saw at the beginning of the pandemic, but more specific ones, certain areas depending on where there are outbreaks. Do you anticipate more shutdowns or more specific shutdowns in the near future if we don't, for lack of a better term, get our act together?
Yeah, thanks, Nick. Good to hear from you. There are no shortage of experts out there pontificating about their ideas about what's the right thing to do. It's amazing. I think it's a new industry that popped up in COVID. COVID experts are just sprouting like weeds. But I do feel that you're onto something. I mean, clearly, if this outbreak is allowed to continue to grow, we will see impacts on our healthcare system that will be intolerable for all of us. None of us will want to see ourselves, our family members, or our loved ones denied care or given care that is less standard or less desirable than they would have gotten otherwise, or perhaps have outcomes that would have been preventable because of healthcare system overload and compromise. We do not want to go there. We're going to do everything possible to prevent that from happening. The question is, what's the right time to act? I am not a fan of waiting until the last moment when our healthcare system is already teetering on the brink, because at that point you have to do the most severe measures, and it takes longer to bring the cases down to the level that would be manageable again. Which is why I'm out here every week trying to explain where we're at, that we still have the option to voluntarily, as a community, change our behaviors and change the course of this and the trajectory of this outbreak to avoid that type of stress on our healthcare system. But if we do start seeing that, if we see, particularly after Thanksgiving, which is what I'm incredibly worried about, if we see people continue to with their usual Thanksgiving plans and gathering groups, we will undoubtedly have a very unmanageable situation coming out of that. And so we really need people to think about this holiday and think about how to make sure that next year everybody in the family is at the dinner table and we don't lose people that we otherwise would have been able to celebrate with by acting responsibly and doing everything we can this Thanksgiving. This isn't going to be happening again probably next Thanksgiving, I think, but I think we need to do whatever we can right now between now and then to change course. So if we don't see the things going in the right direction, we will be working with our healthcare system to look for early indicators of dangerous stress, and we will have to impose restrictions that I think we would rather not. We would rather have people be able to make the decisions for themselves about doing things more safely in a limited way, and mask use and so on. But if that doesn't happen, if we can't get enough people behaving safely enough and cases continue to rise and we feel our healthcare system is being compromised, we'll have to make policy changes that will involve cutting back the types of activities that people can do in the community. And we really want now to bring our kids back to school. We want the economy to be healthy, but we can only do that if we act responsibly in our social lives and our recreational lives and outside of the workplace. And so we have this window of opportunity now in which we're going to sink or swim. We're going to either take charge of our behaviors and turn it around a bit, or we're going to teeter down a very dangerous course and have to use restrictions that we would rather, not.
Thank you. And I know we're running up against time. For those of you whose questions we're not able to get to today, feel free to email us at phpio@kingcounty.gov and we'll follow back up with you. But let's take at least one more question. Pablo Gaviria from Univision, you're unmuted.
Gracias. Y si está bien, me gustaría hacer la pregunta en español.
Sí, por favor.
Si el riesgo de contraer COVID es más alto ahora que nunca, ¿por qué tenemos menos restricciones que en el pasado? Y pienso que muchos se preguntan si será necesario cerrar un poco más la economía.
Yes, thank you very much for your question, Pablo. Jeff, Pablo is asking if we are at the highest number of cases that we've seen. Why are we in a situation where we have less restrictions? A lot of folks are trying to wrap their mind around that. So that kind of distinction, particularly because we are at the highest levels we've seen.
Yeah, buenos dias, and thank you for your question, Pablo. I think the restrictions that you're referring to are probably related to the governor's directives and that they've been loosened up a bit. And those predominantly predated this large increase. We certainly do not want to see any loosening of restrictions now that we're seeing the increase in cases. And I know that the governor's team and the state health agency and we are all thinking of what policy steps might be necessary should we see, this worrisome impact on our healthcare system begin. At this point, we're seeing cases occur, and thankfully, largely in younger, healthier people who are not requiring hospitalization. Now, COVID can be a very severe disease, even in younger and healthy people. There's not only a very nasty illness that can last for weeks to months, but there are some unfortunate people who develop what's being called long COVID, which can last for many weeks, many months. There's just so much unknown about it, but it can be quite debilitating. So preventing cases in and of itself is worthy, but we're really concerned now about this issue around healthcare system access and providing life-sustaining and critically needed health services, and that is probably going to be our trigger point. So we're going first, as always, with a request to the public for voluntary compliance with pulling back and restricting their activities and restricting the number of contacts, the duration of contacts with others, avoiding indoor crowded air spaces, avoiding crowds in general, wearing a mask at all time, and hoping that people will get that message. And if the numbers continue to rise and we see, impact on hospitalizations and/or deaths. And by the way, both of those are lagging indicators, which means hospitalizations occur several weeks after the case counts rise and deaths occur several weeks after that. And they also depend on the particular social patterns in the community of who's in contact with who. But this is why, cases are rising in the face of these recently liberalized restrictions. So, from my perspective, what I would like to see kids back in school, and whatever we need to do to make that happen with respect to in adding additional restrictions, as long as things can be done safely and we can remain economically viable, that's the way we should go. But at this point, our course has been already determined for us by very high case counts, and we're needing to pay attention to that before we can talk about doing anything additional.
Great, thank you very much. And just because we have so many community members watching here on Facebook, just to wrap up, Jeff, we have one question I wanted to pose to you, and then feel free for your concluding remarks as well. Lots of specific questions since you were mentioning the holidays and Thanksgiving coming in. As one example, a parent who said, I'd really like to bring my freshman home from college for Thanksgiving this year. And should I have them test? What's your recommendation on that? And then any closing words? And should I have them wear a mask? Should we all be wearing a mask for the whole weekend?
Yeah. So with respect to holiday safety, the best advice is keep it to your household. Anyone that comes in will present a risk to your household. A risk will be presented to those who come in, and people can take COVID home to their own household and communities. And again, you cannot tell by looking at somebody or how they feel whether they're infected. If someone quarantines for 14 days after they arrive in the community, that's a good thing to do if that's possible. Very, challenging, but quarantine for 14 days. At the end of 14 days, if someone has not been out and about, they're not going to have COVID. If someone is coming to your home, if you're going to do this anyway, testing immediately before the event can be somewhat reassuring. Tests are not 100%. You can be test negative in the morning and excreting virus and spreading it to others in the afternoon. So the quarantine really is critical, but testing can tell you at least that someone is not actively shedding virus at the time they enter your home. So that can be used, but again, it has to be very close to the time of the event. Indoor events, unfortunately, if you're going to be inviting people from outside the household, should be with doors and windows open or the best ventilation that you can manage, and should be as brief as possible if there are outsiders involved. Masks should be worn at all times in the home when not eating, and you should maintain distance. This virus does accumulate in the air, and if there's not good airflow, if there's a crowd, if people aren't using masks, if someone's infected and doesn't yet know it, they will be shedding that virus, just like cigarette smoke accumulates in the air. And when it reaches a high enough concentration, if the room is small enough or there's enough people crowded in, others can be infected. So remember, it's not just people coughing and sneezing. It's actually a virus that is expelled in the air we breathe. So keeping the gatherings as small as possible, preferentially household only, is the best advice.
Thank you very much. And I want to thank our media partners and our community for joining us today. And muchas gracias a los medios de comunicación en español que están con nosotros hoy día. Anything else, Jeff, before we wrap up?
First of all, thank you everyone for joining us today. Thank you for your continued interest in communicating to our community and to the public about what's happening and what they can do to influence the course of this unprecedented challenge favorably. I anticipate we'll have a lot to talk about over the coming weeks, and I hope that for the sake of all of us that we can turn this around, and if so, it will be in some great measure due to the work that you do to help us get the message out. So thank you.
Thank you very much. Good afternoon and stay safe.